Your comments are a great point of departure for a conversation which we'll have now. I would start, though, by thanking you for your comments about your son and wish you great adventure ahead.
Oh,
you
yes.
will have it. You will have it,
We've
and
just begun.
you've just begun. I want to start with something that has been mentioned here a great deal today, which you did not mention, and give you an opportunity to talk about that. The ticket that you endorse, and on behalf of which you speak here, has supported the idea of reforming Medicaid by turning it into block grants to the states.
Yes.
This is something that has caused great angst within the disabilities community, a great deal of criticism from others who have preceded you on this platform. Would you address that, please, in particular with respect to the principal concerns that block granting this to the state locks it in against inflation and population growth, locks it in as something that can be applied across the country unevenly, locks in potentially a place that states can go to cut costs down the line at the expense of the disability community.
Right, right. Well, I recognize, Governor Romney recognized that Medicaid is an important program. It's a very important program. It's a program that costs us a lot, but it's also a program that does a lot. And for the disability community, it's a very important program. As we move forward, we need to make sure, and I am committed, I'm one that is committed to making sure that the protections, important protections for those with disabilities is maintained. Now, when I talk to governors, including the governor from the state of Washington, you know, there's some realities that we're facing. The Medicaid program is currently funded 50% by the federal government, 50% by the states on average. And both at the state level and the federal level, Republicans, Democrats alike are being forced to make some very difficult decisions. As we move forward, I think as we think about Medicaid, it is very important that we maintain the protections for those with disabilities. As we are expanding Medicaid and expanding who's going to qualify for Medicaid, I think within the disability community we need to be especially focusing on those with disabilities. And I mentioned what happened in Washington State as an example, where Governor Christine Gregoire has been forced to make some really tough decisions, things that she never thought she would be doing. And in order to balance the budget, ended up making some very difficult cuts to Medicaid and to the disability programs within Medicaid that she has long supported. And many of you are probably aware there's even a lawsuit that is ensued after that. But this only followed after Governor Gregoire and the Republicans and the Democrats in the legislature had asked for a waiver from the federal government to have more flexibility. And the administration, Health and Human Services, said, no, we're not going to give you that flexibility. And they had asked for that flexibility so they would be able to avoid some of the cuts that they had to move forward. They thought that there was a better way, that they could have prioritized funding for those with disabilities, and yet they felt like they were given no other option. And so what I see in Medicaid moving forward, and the proposal that has been on the table in the House, is one that will provide the flexibility to the states so that they can make the smarter decisions. So it's not these just across-the-board cuts, but I also see where it is very important as we're moving or modernizing Medicaid. We shouldn't be afraid about bringing a program into the 21st century and what it's going to look like. And my last point would be related to the institutional. We need to change that bias and focus Medicaid on home and community programs. Washington State is number 2 as far as the commitment to home and community programs. All of this, I believe, can be accomplished if we're not afraid to at least look at Medicaid in ways that we can improve it.
The concern, as I hear it, and has been represented here, is that certainly flexibility is one side of the equation, but the vulnerability to budget cuts, to its inability to grow the program, to protect such programs as home health care and that kind of thing, creates a fundamental vulnerability in going to block grants. Does Governor Romney agree with that? Or do you find, can you explain some way that those things will not be vulnerable if you move to a block grant system?
Well, I certainly recognize the concern. And what I've been exploring, and this is me personally, is whether or not we can put some protections at the federal level in place, some safeguards, some must-haves within the program, even as we move more of the decision-making and give that flexibility to the states.
Do you feel that the concern in the disability community about block granting Medicaid is misplaced?
No, I can see where the disability community needs to make sure that what has been accomplished through the years and what is the protections that are in place are that they continue. What I think, Medicaid is being asked to do a lot as we move forward. And one of the thoughts I want to explore is whether or not we should pull even the disability portion out of Medicaid and make sure that we have some kind of a program long-term that is clearly protecting those with disabilities and making sure that a program continues over a longer period of time, and that those with disabilities and the important funding that is needed to serve those with disabilities in the home, in the community, is not taken away in order to meet the needs that are being added to Medicaid as we move forward.
If Governor Romney were here today and were asked about the vulnerability of some of these programs if Medicaid were to be block granted, what would he say?
Well, as his, in representing Governor Romney here today, there's a recognition on both sides of the aisle, Republicans and Democrats, that these are important programs. Medicaid is an important program, and as we move forward, we need to make sure that we are protecting those that are dependent upon Medicaid and those that have long got important services through Medicaid. There's also a reality that we're going to add 30 million more people to the Medicaid program, and the demands that are going to be put on that program are going to be fierce. And that's where I think the disability community, as we move forward, needs to make sure that we're thinking through how do we make sure that we protect those with disabilities. And I shared Washington State. Washington State didn't want to make the decisions they did, but because they didn't have the flexibility from the federal government, they were forced to make cuts to important disability programs because they didn't have the flexibility to do anything different.
So is it unfair, perhaps, for Ted Kennedy Jr. and for Barack Obama to, and I'm not trying to set one side against the other, but clearly lay out what's at stake here, for them not to say to the disability community, look, we can't afford all this. We're going to have to make some tough decisions.
That they said that?
No, that they're not saying that.
Oh.
Is that, in other words, is what Governor Romney, people, say, is trying to lay it out straight, right? And we're going to do this because we're going to, and there may need to be some things on the table.
Well, what I would also add to that conversation is that I believe that some of this can be accomplished by doing things smarter, and when I talk about states having more flexibility, I think it would allow them to be a little more creative in the way that the services are delivered to those that are in need, and really bringing it back to the individual and giving the states and the families as much flexibility as they possibly can to make the decisions that are needed for that individual, but not have it dictated so much from Washington, D.C. that you're spending money on things that you don't really want to, but you have to because that's what Washington, D.C. says.
So.
Okay.
The Ryan budget has been widely discussed, and it's unclear exactly what role that plays in Governor Romney's plan. Calls for $700+ billion cuts in the Medicaid program. Is that part of the plan, and what impact would that have on the disability community? Well,
Governor Romney, I know Governor Romney's plan would increase funding for Medicaid every year. As you look at it moving forward, and where we really.
And what about those $700 billion+ cuts?
The proposal that was in the House was more focused on the flexibility to the states, and I've had some good conversations with Governor Gregoire from Washington State, who's a Democrat, and I've been talking to her about how do we move forward on Medicaid. And what she asked me more than anything is for the flexibility. She says, Cathy, we can do things, we can do so much more than we currently are able to if we had the flexibility to move some of that money around. Now, I'm not saying that $700 billion that you brought up is the right number. Is that what it is? Is that what you said? But I do think
it's actually a little over 800.
There are ways that we can deliver these services smarter, and we shouldn't be afraid of having that conversation.
Another concern with respect to Governor Romney's agenda within this community is his comment to repeal Obamacare. Mm-hmm. And many of the issues that address directly the people with disabilities in the president's very controversial health care reform law, specifically pre-existing conditions, lifetime caps, annual caps, that sort of thing. What would become of those protections in a repealed Obamacare Romney administration? Well,
many of the list that you just laid out, there's actually bipartisan support. There's bipartisan support for making sure that those with pre-existing conditions can access health insurance plans in America. When you look at both what the Republicans were putting forward as well as what the Democrats put forward, there was quite an emphasis on high-risk pools, expanding the high-risk pools, more investment in the high-risk pools. These are areas where there is some bipartisan support. Yes, now, I don't want, it's clear that the Republicans believe that we can do better, and that we believe it is best to repeal this bill and start all over.
So what would you do? So you'd start over again. So
right.
What would you explain to people how that would happen, how long that would take? Look how long it took
right.
for this to happen. I've been in Washington a long time.
Right.
Feathers have been flying for years, right?
Right. Well, there's quite a pressure on, there'd be quite a pressure on Congress to take action quickly. From my perspective, it's very important that healthcare and healthcare decisions remain in the hands of individuals and families. And that is what concerns me most about the president's health care bill, is that I am concerned about legislation that gives so much power to federal government agencies to make health care decisions that I want to be making myself. And I share one example with you. When Cole was first born, my husband is retired from the Navy, so we have access to TRICARE. We, like any American family, we looked at how much the costs were for TRICARE versus the private health insurance plan that I was currently on, Blue Cross Blue Shield, Primera, and we made a decision to put Cole on TRICARE. Well, you know what? I learned a valuable lesson because I couldn't find a physical therapist, an occupational therapist, a speech therapist in Washington, D.C. that took TRICARE, because TRICARE didn't reimburse for the actual cost of delivering that service, even though when you read TRICARE, it says that you have access to that, right? And what I also learned is that TRICARE in Washington, D.C. reimburses less than Medicaid. And Medicaid doesn't reimburse for the actual cost. And what concerns me about whether it's TRICARE, Medicaid, Medicare, and the promise of the president's health care bill is that the government is not being honest about the actual cost of delivering what is promising. And the access to and trying to find the doctors, trying to find the specialists. You cannot, right now, try to find someone who will take Medicaid, take TRICARE. Medicaid ends up in emergency rooms because you can't find doctors who will take Medicaid. So it's a false promise.
What then would the Romney plan look like?
Governor Romney has laid out an extensive plan. He is committed.
I don't mean
to
the
healthcare
whole.
reform.
I don't mean the whole Romney plan, but I mean specifically for protections for those and coverage for those with disabilities. Granted, there are lots of nightmares with Medicaid, TRICARE, Medicare, and they're all different one from the other. Different reimbursement levels, different income levels, all of that. There are also frustrations with private insurance. I think people have had one or two of those moments in the past.
Yes.
Specifically to the question that is raised by this audience is what would replace an admittedly imperfect system in terms of protections for the disabled in their medical treatment and care.
There is a commitment to pre-existing conditions and language that would ensure that no matter if you have a pre-existing condition, that you would have access to health insurance plans in this country. We also need to address what is the cost drivers within the current healthcare system, and I think what you'd see in the proposal is some efforts to look at what's actually driving the cost of healthcare, because, right, you know, despite the fact that it's called the Affordable Care Act, it really didn't address the cost, and we're seeing record skyrocketing health insurance costs even right now. And so we need to address what's driving the cost of healthcare. We need to bring back more choices for individuals and families in the marketplace so that they can go out there and access the plans that they need in order to meet the needs of their families. And there's a whole set of reforms that would.
Another very important
accomplish
concern revolves around long-term care and supports. Right now, you have to exhaust your resources and end up with Medicaid to get into, admittedly then, a limited kind of program. What kind of supports, improvements in the financing of long-term care services and supports would Mitt Romney bring?
Well, you know, I am encouraged that we're seeing a movement towards home and community care. And it's estimated that 90% of seniors, when asked, would prefer to stay in their homes. And I think we need to, you know, we know that institutionalized care is very expensive, and we need to continue that commitment to providing the support that a senior would need in their home so that they can stay there as long as possible, whether it's technology. There's exciting technology available now that would allow seniors to stay in their home. So that's one area, is to provide the support necessary so that our seniors can stay in their homes as long as possible so that they don't end up in the nursing homes. And I think it's a win-win. I also would like to see, boy, I just lost my train of thought. For seniors and, I'm sorry,
long-term care, in-home, who pays, how that gets done.
Right.
Is it Medicaid? What happens if Medicaid is block granted? Does that go away
okay,
too?
I would say, okay, that's where thank you.
Okay.
I wanted to, I think we need to look, long-term care insurance is still very expensive. And,
very expensive.
And I think for a lot of people, when you look at it, you just kind of think, this is too much money, I'll take the chance. And I think we need to look at some incentives so that more people would actually save and buy the long-term care insurance.
But there's a real problem with that, if I may.
Okay.
I mean, there's a real problem with that. I have about 50 million Americans. Medicare covers about 50 million Americans. Just under 9 million of them are people with disabilities. Something like 2/3 of Medicare beneficiaries have incomes under $30,000 a year. How are they going to afford long-term care insurance?
Well, I'm not saying it's for everyone. But I do think that there's a number of people in America that if we put in some incentives so that they would actually invest in long-term care insurance, that they would go ahead and do that. And that's the direction we need to move, rather than it currently being the approach where, you know, if you're smart, you don't pay for that long-term care. You actually give your money, your assets away. You spend down your assets so that you qualify for Medicaid, and that it's the government paying those bills rather than you as the individual. And what we see is that long-term care costs are just skyrocketing. So